Good day everyone, this is Group 4 and we will be discussing about case study number 6, all about musculoskeletal diseases.
So, what is musculoskeletal disease? Musculoskeletal diseases, also known as MSK, are a wide category of disorders that influence people and healthcare systems throughout the world and cause substantial morbidity. These disorders affect muscles, bones, joints, and connective tissues. Age, gender, heredity, and obesity are risk factors of these illnesses, which can be either non-inflammatory, like osteoarthritis and osteoporosis, or inflammatory, like rheumatoid arthritis and gout. To lessen their impact on society and the economy, MSK disorders necessitate focused preventive and management techniques because to their high incidence and correlation with chronic pain and impairment.
Prevalence of musculoskeletal disease in the Philippines. Musculoskeletal diseases represents a pressing public health concerns in the Philippines, impacting diverse population groups due to factors such as occupational strain, aging, and lifestyle-related challenges. To provide a broader perspective, national data on musculoskeletal diseases in the Philippines highlights their significant prevalence across various demographics. While specific national prevalence rates are not consistently consolidated, injury surveillance reports from the Department of Health indicates that musculoskeletal injuries rank among the most common occupational health concerns. These injuries are often associated with repetitive tasks, heavy lifting, and prolonged awkward postures, affecting both younger and older populations. A study focusing on physical therapies in the Philippines reported that 87.23% of respondents experienced musculoskeletal symptoms within the past year, with the lower back identified as the most frequent area affected. Furthermore, injury surveillance data underscores that prevalence of musculoskeletal injuries, particularly among younger individuals and males. These injuries are commonly attributed to repetitive motions, heavy lifting, and sustained awkward postures in various work environments.
What is a dietary management for the treatment? Musculoskeletal conditions affect millions of people worldwide, causing pain and limiting mobility. While traditional treatments like medication and physical therapy can be effective, growing evidence suggests that nutrition plays a crucial role in managing these conditions. Adequate consumption of essential nutrients such as calcium from dairy products and leafy greens and magnesium from oats, nuts, and seeds supports bone density and muscle function. Vitamin D and protein are also vital for bone health, helping prevent conditions like osteoporosis. Additionally, inflammation is a key contributor to musculoskeletal pain, making a diet rich in anti-inflammatory foods such as fruits, vegetables, whole grains, and omega-3 fatty acids from fatty fish, walnuts, and flax seeds beneficial in reducing symptoms. Complex carbohydrates aid in calcium absorption, while excessive sugar intake should be avoided as it weakens bones and muscles. Healthy fats improve joint mobility, whereas trans fats and excessive saturated fats should be limited. Maintaining a balanced diet, staying hydrated, and incorporating anti-inflammatory foods like berries, green tea, and turmeric can enhance musculoskeletal health while also supporting weight management to reduce stress and joints. As research continues to highlight the link between diet, exercise, and musculoskeletal health, increasing awareness and education on the importance of nutrition in patient care is essential.
What are the foods allowed and avoided To begin with, managing musculoskeletal diseases through dietary choices involves understanding which food can help alleviate symptoms and which ones may exacerbate them. Foods that are generally encouraged include those rich in omega-3 fatty acids, such as fatty fish. Example would be salmon and mackerel, walnuts, and chia seeds. So these foods are known for their anti-inflammatory properties and can help reduce joint inflammation. Additionally, a variety of fruits and vegetables, especially those high in antioxidants like berries, spinach, and kale, provide essential nutrients that support overall joint health. Whole grains such as brown rice and quinoa are also beneficial as they offer essential nutrients while promoting healthy bodily function. On the other hand, certain foods should be avoided as they may contribute to inflammation and worsen symptoms. These include processed food, high in sugars and unhealthy fats like fried foods, sugary snacks, and refined carbohydrates. Furthermore, excessive consumption of red meat and high-fat dairy products can trigger inflammatory process in some individuals. Therefore, it is important to maintain a balanced diet focusing on anti-inflammatory foods while minimizing processed and sugar options to positively impact the management of musculoskeletal disease. So for day 1, for breakfast, we have here an oatmeal topped with fresh berries and a drizzle of honey. For lunch, we have grilled chicken salad with mixed greens, cherry tomatoes, and cucumbers, and vinaigrette. And so for dinner, we have baked salmon with quinoa and steamed broccoli. So for day 2, breakfast, we have chia pudding or walnuts. Lunch, faro bowl or hummus and snap peas. And for dinner, we have tuna rice bowls. So for day 3, we have for breakfast a smoothie with spinach, banana, almond, milk, and protein powder. For lunch, we have lentil soup with whole grain bread. For dinner, we have grilled shrimp tacos with cabbage, slaw, and salsa. And so for day 4, we have for breakfast scrambled eggs with sauteed spinach and whole grain toast. Lunch, quinoa salad with black beans, corn, and diced pepper. For dinner, we have baked chicken breast with sweet potatoes and green beans. For day 5, we have for breakfast is chia seed pudding with almond milk and topped with mango. For lunch, we have hummus and vegetable wrap with a side of mixed fruits. Dinner, turkey meatballs with zucchini noodles and marinara sauce. For day 6, for breakfast, we have whole grain pancakes topped with sliced strawberries and maple syrup. Lunch, caprese salad with fresh mozzarella tomatoes, basils, and balsamic glaze. For dinner, grilled fish tacos with avocado and side of black beans. And so for last day, day 7, we have for breakfast is smoothies bowl with mixed berries, granola, and coconut flakes. For lunch, we have chickpea salad with cucumber, tomatoes, parsley, and lemon dressing. Dinner, stuffed bell peppers with ground turkey, rice, and spices.